Good afternoon, everyone.
Hello and welcome to today's webinar, Surviving and Thriving in the Health Reform Era. Before we get started, I'd like to announce a few brief housekeeping details. Today's session is being recorded and an online archive of today's event will be available a few days after the call. You will receive an email from AHIP that will ask if you would like to receive the archive. Please respond to the email if you would. I'd like to remind you of AHIP's antitrust statement and ask that you reference it in the Handouts tab. The antitrust statement prohibits us from discussing competitively sensitive information. This information includes company financial information such as prices, reimbursement, premiums, margins, or market share. Company product and sales information such as product sales, sales territories, future products and customers, and company information about terms of coverage. Please keep in mind that you may also ask a question at any time during the presentation by typing your question into the chat box located in the lower left-hand corner of your screen and then click Send. You can adjust the size of the slides to fit your screen by clicking on the Scale button located in the upper right-hand side of your screen. We are very fortunate to have with us today Eugene Cyan, Sotheon's founder, chairman, and chief executive officer. As Sotheon's founder, chairman, and chief executive officer, Eugene Cyan has been responsible for creating the company's vision and strategic direction to address health insurers' goal of meeting PPACA milestones, interacting with federally facilitated marketplace and state-based marketplaces, extending access to quality, affordable health insurance coverage for potential members in all markets and regions. Over 25 years, Mr. Cyan has developed and nurtured innovative solutions that are adopted by many healthcare payers, providers, and government agencies, including Massachusetts Connector, the nation's only fully operational state health benefits exchange. Currently, he is leading a multi-year plan, design development, and commercialization of business orchestration platform that is designed for insurers' marketplace businesses, facilitating plan, catalog management, and marketplace qualifying health plans, certification, automating individual and shop eligibility and enrollment underwriting, streamlining online bill presentment and payment, and enhancing consumer experience management through self-service portals. Mr. Cyan serves on the Stony Brook University Computer Science Advisory Board, Big Data Analytics, and Visualization at Center for Dynamic Data Analysis Advisory Board, Center of Excellence in Wireless and Information Technology Advisory Board, and is a member of the Board of Directors of Long Island High Technology Incubator, where he contributes to the growth of technology-based startup firms. He has a master's degree in computer science from the New York Institute of Technology and an undergraduate degree in electrical engineering from the Istanbul Technical University in Turkey. At this time, I would like to turn the floor over to the speaker, Eugene Cyan.
Thank you, Brenda. Appreciate that. Before we do start, in fact, I do have a little a disclaimer to make. It's no longer the Massachusetts Connector is no longer the only exchange, but it is the first fully operational health insurance exchange since 2008. Good afternoon, everyone. Today we're going to talk about a little bit of the healthcare technology, what we call the business trends. We'll talk about the 5 specific trends as it relates to the health insurance marketplaces, kind of taking a little snapshot of where we are today and where we think the direction in general the health insurance services and delivery is taken, if you will. So to add on to a couple more comments about Softheon, we are a research-oriented organization. We do work with many carriers as well as the state entities, especially in the areas of cloud computing, real-time data analytics, big data, as well as predictive modeling. For those of you, if you have been to, I will ask you or urge you to visit us online. One of the things that we do provide through online educational distribution is our daily connector newsletters, which basically provides you most up-to-date daily information about the news that is related to the marketplaces in general, as well as the any relevant information for the consumerism aspect of healthcare payer delivery model altogether. Just a quick little snapshot of it. We have been actively engaged with several state exchanges as well as federal exchange. Today, as you can see, that despite the early challenges were associated with the healthcare.gov website, many of the technical problems are being addressed. We are now seeing basically a continuous uptick in the enrollments processes altogether too. Some of the numbers have been shared across, and Softian has a presence of many of these federal and state exchanges. Obviously, we don't have the numbers from the federal system altogether, but we are seeing literally about 30 or 40% increase on a daily basis increase in the enrollments. Now the challenges are still continue, as you know quite well, very recently, which we will talk about extensively, about the things like pre-audit files or to orphans and CMS and carrier orphans and so on and so forth. But today we'll talk about a little bit more broader terms, if you will, with specific examples, however, case studies, as we discuss the details of what we think that where the opportunities and the challenges reside within the healthcare payer space. As you can see, across the board, there's a nice enrollment numbers coming across, mostly being the California and the West Coast has a very good uptake altogether. We do know that also the New York is a fairly good progress being made there too. And the overall, I think the theme is exchanges are here to stay. Until very recently, there was a lot of question whether the federal exchange or state exchanges will be successful. Like everything else, for those of you who've been in the technology world long enough, I'm sure you realize it and appreciate the fact that any kind of technology projects really is always have a little bit of a bumps. Now in this case, one thing that I do want to clarify, Softiana has no engagement at the federal level, so nowhere that we are partly responsible of it. However, we do sympathize some of the challenges associated with a system like health exchanges are being basically brought online. And we think that most of the technical issues will be resolved. However, the challenges will continue to propagate, if you will, in different areas as we discuss let it be the 3R conditions or let it be the ongoing business rules element to it with the ever-changing provisions and laws as being rolled out by CMS. So within the marketplaces, as we mentioned it to you, Softiana has been working with the Massachusetts Health Connector since 2008. Up there, in fact, these numbers have been exceeded since the beginning of the year. We are looking to more of upwards of 210,000 people or so. So the Massachusetts Health Connector being this nation's first health exchange altogether, these individuals are being transferred into what we call the Health Connector 2.0 implementation, which is fully ACA compliant version of it. So our value proposition working with, which we will talk about it, is an organization like MedWise, for instance, the regional health plans is the category that we're going to be talking extensively. And no surprise to anyone, by the way, that as you're going to see very shortly, the significant percentage of the plans or carriers are competing now, transition into marketplaces, happens to be the regional health plans with significant presence transitioning from being a regional Medicaid-based plans to do now the marketplace plans altogether. So in fact, this is a slide literally taken off from the last week for those of you who had participated at the Exchange Conference in DC. One of the kind of eye-popping experiences were there that of the 100% of the health plans carriers that are participating in the marketplaces, nearly half of those plans are in fact regional Medicaid plans that are basically participating, giving their ability to interface and interact with the consumers. They have taken this opportunity to kind of leapfrog themselves into the consumerism market, whereas to many surprises that only 6% of the carriers are participating are in fact our commercial health plans. We're also seeing a significant uptick in the whole new co-op market. As you know, that over 20-something, I believe last number that I know was 26 or 27, these carriers basically started from scratch. They were funded by the ACA, but the co-ops could become. Now, granted, again, their features are, again, could be questionable. And nevertheless, that they are participating very heavily into and bringing to a certain extent option and choice to the marketplaces. Another interesting trend in the overall marketplace is what we are finding there. Many smaller health plans that they are trying to be competitive, price competitive, and one way they are able to do so by literally creating a narrow and an ultra narrow health plans altogether. As you can see right in here, that nearly 68% of the type of plans, I'm referring to the QHPs, has some elements of basically the description of a narrow network description altogether. So these networks are being fine-tuned in a sense that being a price competitive, if you will, still meeting the essential health benefit requirements of ACA. So we believe these two trends will continue to evolve over the years. And perhaps one thing that we are already thinking of that through the exchanges and aggregators, perhaps a better term to use is let it be public or private exchanges, where the multiple carrier product will be able to kind of offer to consumers. We're expecting to see something very similar to the airline industry, where the star alliances will be formed between the narrow and ultra narrow networks altogether, that the consumer will have the ability to have the transparency or the flexibility being able to pick a carrier or a plan, yet the benefits will be delivered through multiple narrow networks as the small regional health plans coming together and offering this kind of a broad product in essence, but only through the consortiums and collaborations, very much like the Star Alliances type of product services that are available in the other type of industries. So from that perspective, the trend, I guess the very first trend in the era going forward, we believe the public and private exchanges is the way to go. Clearly, up until very recently, the exchanges were kind of, again, a lot of folks were on the fence, but only within the last, probably I will say about since August, we have seen a significant activity. And in fact, from our perspective, Softeon today works with 22 health plans as we speak in production, and we are bringing 16 other health plans to the production in various stages altogether. And then we have numerous opportunities that we are already in a little early stages perhaps, but getting those carriers ready for 2015 and beyond. So that the exchanges are here to stay. And the question is about how do you interface with the exchanges? In the traditional model, today's model, or I should say that the more common approach to this problem today is what we call it a point-to-point solution. So you have basically three distinct consumer groups. Let it be consumer itself, the brokers and navigators will be interacting with the exchanges either through state exchanges or directly with the payers. And on the back end side, there is the element of federal exchange that also includes the data hub services, which is mainly for use purposes like subsidy calculations and APTCs and CSRs. But the interface, as you can see here, there are quite a few touch points in between all these distinct group of individuals altogether. So the challenges become that what happens if you decide to go with exchange with one state exchange or one public exchange, but later down the road you decided to move on to other exchanges and perhaps even your own quote-unquote consumerism or single carrier exchanges, which is mainly a basically consumer website. The current model is not sustainable. So one of the very first things that we see among the trends is that the establishment of what we call the enterprise business bus, if you will. And what that is really is shown in the next figure, so that the payers are being able to leverage. You don't have to quote-unquote rip and replace to your existing system to be a competitor or participant of an exchanges altogether. There are approaches you can take, one organization may take, for instance, is this one approach. And the one approach is what's been defined in here is that the exchange connector, which is also referred as edge computing platforms or some other means that enables and shields that the payer's internal IT assets and business processes, which is what we're going to call it, generally call it assets, how you do business today. And those assets could be then surfaced and made available through your exchanges, let it be federal or state exchanges or even private exchanges. The role of the exchange connector in the middle block, which you see here, is the intermediary. It's in essence that the payers is ultimately token to that intermediary, and this intermediary knows exactly how to communicate the nuances. So today's analogy, as you are, if you happen to be one of those multi-state health plans that I'm sure that you've been dealing with many different 834 companion guides, many different implementations. In fact, some of the exchanges are having some little difficulty about getting their initial operation launched. What we are seeing is that the enrollment data coming in through Excel spreadsheets, and sometimes comes up in XML documents altogether. So the purpose of that intermediary block is to normalizing the data. So for instance, speaking for Softheon, we are able to do that, and from our perspective is if we are able to do that for one carrier within a given state, that's almost like 90% of the work. And through that process, for instance, again, Softheon Exchange Connector, we are able to interface with systems like Facets and QNext and Amisys DST, ICA systems, and HealthEdge. So the Exchange Connector is a platform agnostic, and we're able to talk to the various backend systems through some other conventional, typically an X12 5010 transaction sets, or other systems in some most recent cases in real time. So we are able to do, in fact, real-time quote-to-card implementations. And again, leveraging the technology in the most effective ways. The second big trend that we see in the industry is that the formation of the business rules or business exceptions. I'm sure you're in the middle of it, literally. I believe it's the due date today, is that the last week that CMS made an announcement they're looking for a pre-audit files from the carriers about the type of issues that you have encountered altogether, and then comparing the audit files to, again, for the CMS orphans, we're seeing a carrier orphans where the carrier has more data. Somehow we don't have that information from the initial audit file we got from the CMS. So again, a process like this could be easily done leveraging the technologies, like we call it, a business process rules or business process management. So what you're looking here again from a collective experience is that we are able to isolate these individual cases as the enrollment transaction coming through various sources. We are able to stop the bad data, corrupt data upstream, let it be incorrect rate information, which we are seeing quite a few of them, where either the CMS is penny more or penniless from the rates were issued by the carriers. But nevertheless, we don't want those data to go downstream. We're also seeing a lot of cases that the invalid relationship columns altogether, or in many cases that they were missing the FIPS code / county code, so that we're not able to calculate the rate information properly. So utilizing the rules engine component to it, it's the critical to it. And what that really rules engine is that this is typically a business process. As you can see here, this is basically an end-to-end workflow process being defined. So using the tools like the one that are offered, again, there are many, many tools available on the marketplace for you to consider. Let it be a product from Microsoft or Oracle or other type of technology vendors. I'm sure you're able to put them all together, these technology components, and being able to put together business processes in place. The key thing is here is really that there is never a condition where all the IT assets, let it be all the computer assets, like historically that has been the case, under a single roof. So what you're seeing is basically each one of these swim lanes is basically depicts perhaps an ownership. Let it be CMS is the owner, let it be consumer or / navigator interacting with these systems, or let it be carrier, or all the way to the back end, let it be, once again, your financial management systems, or perhaps a subsidy calculations, again, communicating back to CMS for the APTC portion of the member dues altogether, or the rates altogether. So they're utilizing the business process management, what we also refer as a BPM or BPMN notation, business process management notation. It is an asset that we are finding that is being more and more enterprises is looking to use. One of the key benefits of the BPM, obviously, being able to putting the control or empowerment in the hands of business folks. So today we're able to literally have a conversation with our business stakeholders, and in the afternoon we're able to make those rules and put that into the execution. So in essence, in platforms like Softheon, that literally there is a daily upgrades are taking place. Now, clearly that has its own challenges to begin with, but the type of world that we live in these days, it's now requiring to that level of agile interface or interaction between all the stakeholders, because once again, the rules are changing far more frequently than anyone anticipated. And then typically rules are being described. You can see it is that, again, very simple. I can see all the, take your time and read it. Most of the time the rules are being defined by the business folks and putting the business people in charge. That really gives us the opportunity to engage our team, our plan members, to be in a very proactive manner. So they're actually almost part of our development team. As we deal with, work with a Let It Be plan catalog management, the benefit design folks on a daily basis now that we're actually doing the 2015 designs. So we are able to communicate with them on a very interactive manner. And we are able to compare the current utilization as we move forward to the 3 R's. We have already done significant amount of research and the product development in that area as well, which we will talk about one of the trends of that, what we call the big data impact. So it's, again, perhaps everybody's definition of a big data is a little different, but we'll talk about how do we use that data and learn from the data and come back and basically refine our rules. And also many titles are given to this kind of an approach, one of them being the continuous process improvement or continuous ROI. So the business rules of BPMs are we feel that the more pervasive tools are becoming available in the marketplace. Businesses and organizations are looking for ways to be engaged rather than a kind of a waterfall model where you write the requirements and you wait for some time for someone to get back to you so you can do your testing, QA. Whereas in the BPM world is that an agile world, if you will, the business development, QA, and testing and deployment literally on a daily basis activity occurrence that everybody has a certain stakeholder, certain accountability in the process as well. So the next topic is we're going to talk about consumerism. Obviously, what is really driving all these efforts across all industries, if you think about it, is the consumerism. To be honest, as you all know very well, that the critical aspect of ACA was that about bringing that 30 million into the marketplace. Now, I don't know if that 30 million is going to sign up this year or the number is going to be 5 million. It's really irrelevant. What is relevant is that the revolution like the one took in financial services and bankings or even travel industry, what has happened over the time lifespan of 10, 15 years, what happened to the world of Americans or the other ones out there going through that kind of a mergers and acquisition cycle. New carriers are coming up every day in a different value proposition. And what's really driving that has always been the consumers. Consumers are looking for a lot more advanced tools. And with all due respect, and everybody's kind of stuck these days with the websites and everything else, we believe that that website already has exceeded its life cycle. Which you look into the demographic, especially the young and invisible demographic, the mode of communication for those individuals is mobile. So Softheon is, again, we are doing a lot of work with most of our innovator carriers in the areas of mobile computing, how we can able to do all the way from Let It Be mobile payments to the location-based services, how we can combine that with our network data altogether and tie it into the price transparencies and so on and so forth. So consumerism is a critical aspect of this operation to begin with. So one of the elements is that you can see is that what's really driving the consumerism and the marketplaces is in fact called the direct enrollment. I don't know how many carriers, but the increasing number of carriers are now looking to, or already, if not already, evaluating the option to interface with federal exchange through direct enrollment. I don't know how many of you know about the direct enrollment, but in essence, that the carriers are able to create their own branded look and feels, if you will, but the consumers are therefore being kind of catered in a very nice way. But if they decide to go seek for a subsidy through the direct enrollment process, that we are able to interface with the Federal Data Hub and to check for these people's eligibility for a subsidy, as well as the CSRs. And based on some of the earlier problems that we're seeing in there, based on including Gary Cohen's comment last week at the Exchange Conference, we are seeing that there is a movement towards that where we believe that the feds and the states perhaps will move away from this business and move forward the exchange model where the carrier will be able to interface with the same value proposition only through their branded interfaces to begin with. So in the typical direct enrollment model, ultimately, consumer will have the ability to come in and log in. Not only obviously your consumers, but also your brokers or even the navigators are able to interface with the carrier's website. And in this case, this is one of our template models that we do provide today for most of our carriers. So we are able to create a very highly branded custom look and feels website. It's an extension to direct correlation to the carrier's website, and then the consumers are able to come back in, and some point in time the readers, they can go down the route of seeking for subsidy, where they are able to select a product from what's available out there, or based on their income level, I should say, the subsidy is being calculated based on their APTC and FPL levels, and then being redirected back to us so that we are able to then basically offer them the type of products that they are quote-unquote eligible with subsidy. Or they can choose for non-subsidy route. They may say, I'm going to be just looking for a commercial product line pretty much. So we are able to offer our QHPs as a CSR value, so the cost variance value 00, what we call it, is off exchange, also commonly referred as. So that the off exchange in essence is your private exchange, lack of a better term. And it has some limitations to it for the time being, obviously, things like defined contributions and whatnot. But we believe that as the consumers will be more educated, will be asking for these things, we'll be rolling those, making those capabilities available. That's already been developed. So this is a little bit of an overview of exactly how does in the consumerism world, how does the direct enrollment work, for instance, again. So the key thing in here in the slide, what I wanted to emphasize is that your existing systems, let it be your enrollment underwriting solutions or even your premium billing solutions that are being deployed, you need to be able to interact with this. Once again, it's very similar to the prior BPM, business process management diagrams that you've seen it, whereas the consumer will be able to come in and seamlessly being redirected to a federal website where they can do the rest of their eligibility determinations. Once that is completed and then the consumer is deemed to be qualified to receive a subsidy, and then they are being redirected back to the carrier website where they can complete the rest of the business transaction. And in the process, that there is a constant flow of communication, bidirectional communication, can be established between the federal data hub as well as the private exchanges or the carrier website altogether, in this case direct enrollment broker website, and so that the information can be propagated. Under the federal guidelines of direct enrollment, there are 6 or 7 different scenarios. The very first one right now, what everybody is really getting up to speed, is what we call the enrollment component to it, the initial enrollment. But the guidelines and the documentation so far has been provided. Again, there are some challenges around the availability and when will those services will be available. But it is being told that the data hub will later on will support various types of interfaces. Let it be things like an address change, plan change, the change that could affect individuals' availability or eligibility to receive a subsidy. So under those conditions, also there will be some interfaces, but at least for the time being, that we are able to enroll the individuals through this process and then bring them online, and then subsequently the overnight process or the day after, we are able to receive their correlated 834 transactions and being able to complete the transaction set all the way up to receiving the 834 transactions, and so we were able to effectuate them in the process. So this is the consumerism effect to it. So we believe that this type of interface will be more and more available, not only through the website, but more on the mobile platform as well. Let it be, again, different kind of techniques that are being developed. So the next big trend that we are seeing among the carriers is that the overall financial management. So the financial management now is becoming something of a unique value proposition, an indicator or a matrix, if you think about it. Obviously, what makes it more challenging with the marketplaces and the financial management aspect to it, it's the ability to keep track of all that relevant information as it goes through the processes of, collecting the member portion of it from the consumers versus the subsidy component to it, the reconciliation of that 820 file, which was going to contain the APTC, and there are on top of it the federal subsidies. There are some state subsidies like the case in Massachusetts and in Washington. So we're expecting 820s, whether they're going to be done, the carrier is going to be, the premium billing will be done by the state entities altogether, or will be left out to the carriers, or even in the context of it, within the next year or two, per ACA, that the consumers can actually dictate, even on a state-based premium billing operations, that the consumer has the option to choose or ask for carriers to be the entity that they want to interact with. So in essence, the carriers needs to be able to provide the premium billing solution, even on our state-based exchanges. So in that model is that the financial management component is going to be a very critical element to it. So clearly is the one big topic on the obvious financial management is the premium billing. So the premium billing is that if the individuals unless they are fully subsidized, 100% APTC, but there's a large demographic of individual will fall into the category that they will have to pay some money, if you will. So in that model, if you take an individual model, individual product line altogether, or family individual coverage, so we're going to be dealing with perhaps a household that we are able to provide a different rates, if you will, depending upon the family compositions, husband and wife, the kids. As you know very well, that there are rating engines that are being available. So one of the things, in fact, we are able to provide is our ability to upload all the QHP definitions as being submitted to SURF, as well as the rate tables, and being able to provide that information in real-time rating engines. So the key thing is here, because those rating engines are going to be critical in the success of it. Otherwise, you can be sure that there will be some news somewhere along the way that there is going to be discrepancy between the rates that are offered by the federal exchanges or exchanges in general, because there could be a latency. We do know that right now the rate review is an annual process, but we believe that process could be in fact brought down to a quarterly rate reviews, which is in the case for several states already considering that option as well. At some point in time, we might be even at monthly rate reviews. So we don't know how sophisticated, how real-time these exchanges will happen, and how long will it take us to get there. But inevitably, we see the price differentiation or changes taking place very, very quickly. 1 second. Something happened in here. My presentations went back to... Okay. So we are able to provide a very unique premium billing. So the complication about the premium billing, the trends we're going to see is there with the ACA and full implementations, that the individuals within the family could also subscribe to different plans, or also commonly referred as the highest plan IDs, with a different rate structure. So you need to be able to create a composite bills even at a family household level, let alone at the employee choice level, at the small group shop plans altogether too. Perhaps in the premium billing compositions in private exchanges will also have the elements of defined contributions, where the employer will make certain amount of contributions towards perhaps a percentage of the plan, or it could be a fixed fee towards an employee's coverage altogether, where the individual will be then responsible of the remaining portion of it. So we are able to offer all those products and services, as well as the operations like a lockbox operations, as well as electronic bill payment and presentment portals. So this is all part of the premium billing solutions, because many of us today very accustomed to, and perhaps to a certain extent spoiled by, our ability to go online and make a payment. This is the same exact behavior that consumers be looking for, and meaning that ability to make a payment, perhaps a partial payment in online, and then or write a check partially. So it is our job now to be able to reconcile these payments, and you have to apply towards the right coverage periods altogether. The revenue recognitions is a critical component, as you all know very well, so that if the funds are not perhaps allocated, you have to hold basically a deferred revenue contributions altogether. And not to mention that in its current state, the APTCs is very simple, but as we move into the delinquencies or grace periods, as you know that the definition of APTC, once the member becomes a full payment behind, now they are in grace periods, so that the carriers now has the ability to basically pen the claims. So it's not just a standalone entity, premium billing element anymore. It being the source of truth, so that today we're able to generate, for instance, 270, 271 eligibility data for other core systems that where we are able to then notify the claims engines to say let's start penning those individuals, or vice versa. We're able to in fact outreach to our providers to say that these individuals' claims may not be, maybe pended because they are in basically they are in delinquent state altogether. And we also expect that there is going to be some discrepancies because as we move forward, the individual's APTC, as you know, is a function of their income level. And if the individual's income changes for some reason or not, whether it is going to be picked up by IRS or maybe a voluntary basis by the individuals, so this kind of calculation is going to require some discrepancy reporting and reconciliation process altogether. As you know, the CSR is a whole different topic of conversation, but at least for the time being that everybody, I presume, that going for the simple method. But as we move towards the standard methods, we're going to start talking about the out-of-pocket max accumulators and so on and so forth. Once again, all those values will be then ultimately calculated by the premium billing systems, and then we need to be able to pass that information to let it be the claims engines, enrollment engines, and whatnot. Just as any other commercial business, that the non-sufficient funds or partial payments or refunds are also another critical aspects of the financial management systems. So today we're able to, take a credit card processing, but husband and wife may end up making a double payment. So we need to be able to basically revert one of the transactions or refund the individuals where on a partial payment situation that we may receive a payment from a third-party responsible entity, not necessarily from an individual, or it could be the parent of the individuals. As you know, that there are some policies could be where the children could be the subscriber. So we have to develop somewhat of a heuristic algorithms about how to apply those cash values to the right amount, so that the amount could be applied towards either a percentage basis, or it could be on a first come first served basis. So the premium billing system, it's not just an accounting system altogether in this new order, if you will. Subsequently, as we move forward to the revenue recognitions as well as the bad debt calculations, so obviously there are many, many, many different aspects of the financial management system now that the carriers needs to be responsible of managing in an effective and efficient manner. So the final trend that we're going to talk about a little bit more, spend a few minutes, so we call it a big data, but also some of you might be already considering that is what's also commonly referred as the 3R conditions. So it's another prediction, if you will. We believe that once we start producing the utilization data, mainly the claims data, we're expecting the CMS to create a very similar to a star rating in the Medicare world that will enable basically the CMS to be able to ultimately spreading the risks ultimately across multiple carriers. But more of we believe that the 3R conditions will be applied towards the identifying and making sure that the carriers are really delivering the product and services they deliver, and while they're being kind of adhering to a lot of the MLR, ALR conditions, or being able to better risk management by definition. So as you know, in the 3R conditions, that both the reinsurance and the risk quotas and risk adjustments are going to be all data-driven processes. So that one of the very first data elements will be the enrollment data. So as you know, the enrollment data will be then submitted through this vehicle called Edge Server. So the Edge Server is ultimately going to be a computer residing on among the carrier's asset. Yet it will be owned by the CMS, in essence, the application that basically it will run through your enrollment data. And the enrollment data, by the way, has to be provided on a cumulative basis. So as you go through the January, February, March, we are delivering this data so that the basic April enrollment data will be cumulative of all prior 3 months data as well, not just the people enrolled in the month of April altogether. And data has to be in a standard format per XML definitions that there are multiple XSDs being provided by the carrier, by the CMS as we speak. And then we are expecting again, there might be some delays in the process because of the fact that we still haven't been able to finalize enrollment to begin with. Once we go beyond that, we believe that the individual will be able to basically subscribe to plans and the coverage periods and so on and so forth. As you can see, the hierarchy is very similar to the 834 hierarchy that we're getting from it. The only big difference is going to be they want this data in XML format. So utilizing this data elements, they will be then able to figure out exactly where the certain aspects of those 3R conditions, how it can be spread across multiple payers, multiple carriers, that the risk could be mitigated. There are 2 additional data types that are being requested by the big data in the 3R conditions, I should say, that through the 8 server. Obviously, the pharmacy claims being one of them, and then the medical claims is the another data elements. So the pharmacy claims, unlike the pharmacy and medical claims, unlike the enrollment data, will be on an incremental basis, so that you don't need to keep sending the same 837 data altogether. But in this case, basically what we are looking to a XML translation of the 837 5010 transaction, if you will. Once being converted to the XML format, we'll be able to pass on to these things. And certain data elements will be masked or anonymized data elements altogether too, but certain elements that they are asking for, and we still haven't received a final guidance on this piece altogether. So we don't know at this point. But I think that the overall scheme that we are able to, I presume that this is already a conversation in your quote unquote your exchange task force meetings and whatnot. So the critical element again is here that if we talk about let it be enrollment data, let it be medical data, let it be pharmacy, the goal is here is that to being able to do some sufficient amount of data scrubbing. What we don't want to do, what we don't want our carriers to do, is to sending the data, because once you release the data in the 8 server model altogether, you really have no way to go back and ask the data, and so you can do some additional maybe cleaning effort or scrubbings and something of that nature. Once that is gone, it's gone. It's going to be residing on that server, and then the CMS provided the applications will be able to analyze the data and then report the results back to CMS. The rules are, however, is well defined. So we believe that the rules could be, in fact, pre-scrubbed, if you will, in this world. So we are currently working with some of our carriers about how can we define those rules so that and henceforth that how can we kind of measure and guesstimate at the rates altogether, or the reports, the results that we're going to get out of our data, and so that we can be more proactive rather than being totally surprised by the outcome of the 3R algorithms that are going to be developed, that has been developed by CMS. So we believe these are the 5 trends that's going to be very pervasive over the next several years, if not several months, definitely. And as you know, that there are many changes that are happening. More relevant ones, very recently ones that are being we believe that there's going to be an ongoing transition from the state exchanges to the more towards the privatization, let it be through direct enrollment or through other means. We are still haven't a final guidance, especially how to handle what we call the quote unquote the carrier orphans. In that model, basically the CMS has no prior knowledge about what the data is. So we're hoping that there will be some other tools available to us within the context of it. Our CMS will be able to enable us to perhaps deliver the data in a batch mode, so we are able to do some kind of overnight run. We strongly believe to this date that the eligibility component really has nothing to do with the plan selection shopping components altogether. I think those 2 components could be done independently. And more importantly, subsidy calculation could be done at a much later date, because ultimately, again, many people, I don't like to even use the term subsidy, because it is not a subsidy. It's an advanced payment tax credit. So basically, it's an advanced credit that you're going to get normally the year-end taxes. So we do know that end of the year, the IRS will be responsible party of that, putting together those subsidy reconciliation processes and whatnot. And so based on that premise, that we believe there is no reason that APTC calculation could be, in fact, should be at the same time of a single sitting, single set transaction sets that could be easily decoupled. And we are able to, this is the kind of innovative thinking that we need to come to the table in our current and future conversation with CMS. So there are a few references for you to consider what's on the board. These are mainly, you can see, is that you can find them in the Reg tab or other CMS zone site references altogether. let it be the SOAP UI references or the SAML assertions, which is basically the how we pass the data back and forth between the direct enrollment websites and to the carrier websites, as well as other informational documentations containing the conditions about the RADB conditions as part of the 3R evaluation process altogether too. So with that in mind, I'm going to stop, and if you have any questions, I'm going to turn over to Brenda, and we are happy to take your questions and answer anything that you may have in mind.
Thank you, Eugene. I would like to remind the audience, if you would like to ask a question via the web presentation, please choose the chat pod located in the lower left corner of your screen. Type your question and hit the Send a Message button. And Eugene, we have a question, and it reads, do you have a solution to manage the edge server reporting?
Yes, we do. As I mentioned, that we are working with some of our carriers. We have the elements of data, and we are right now, I don't have the most up-to-date information for you, but our product development team is hard at work right now implementing various aspects of the edge server requirements, including the reporting aspect to it.
Thank you. There are no further questions. At this time, I'd like to turn the program back to you, Eugene, for your final comments.
Well, I think that the foremost that I want to thank the audience for taking the time and joining us. And we know these are exciting times, and I think these are the days that we will be talking to our grandchildren, hopefully one day, because I think the changes that are happening within the industry, it's literally, in our opinion, is the kind of tip of the iceberg. We believe that either we can embrace these changes and basically evolve from it, or we can fight towards it. So obviously we would like to choose the first option, which is the adopting the changes and improving, enhancing upon those changes altogether too. So we'd love to hear from you, the audience. Come and visit us. We have quite a few content, as I mentioned, on our website. There is a white paper that is published by Gartner Group about the CIO's challenges in the upcoming years. In fact, many of these trends that we have highlighted today is in the Gartner's what's called the Hype Cycle. If you happen to be a Gartner client, you might be able to get a copy of that Hype Cycle report as well. But clearly the CIO report is one thing that I will ask audience to read it through one more time. And a couple of things can be accomplished as a result of that kind of a basic educational background in this process. The number one is that you don't need to do a rip and replace. We're finding that some of our carriers are really saying that, well, you know what I have in place is not good, so I'm going to go back and just replace it all out. To us, that's really not the solution, because number one, in the long run, you don't want to run multiple systems and try to managing and operate all together. It just does not make sense from cost point of view. But secondly, there are many incremental ways to create this basically a service stack or technology stack. And by the way, that the concepts and solutions and ideas that we have shared this afternoon with you is nothing to do just unique to Salty. There are many other companies that are offering similar line of products. And in fact, we like to operate in that model, what we call the ecosystem. So we love to be able to cooperate in many partners. Sometimes we do compete. In some cases, we cooperate. I don't want to give a couple of names, but name it, we must have probably interfaced it in this marketplace, either on the state side or the federal side or directly on the carrier side. So the key point about that feature selection or the outlook is to look for technologies that are able to integrate with one another based on common set of standards, and then start looking to areas within your organization that if it requires a more agile response, let it be your consumer-oriented website solutions altogether, or electronic bill payment presenting solutions, or in general interfacing with exchanges. So there are incremental ways to approach these problems using some of the technologies and processes that we mentioned earlier today. So with that in mind, I want to wish you have a very happy holiday season to everybody, and come back and visit us online, and love to hear that from you. Thank you all very much.
I would like to thank Eugene Cyan for that informative presentation and for sharing his thoughts today. Thank you to the audience for participating in today's conference. This concludes our webinar. Thank you again, and enjoy the rest of your day.